Hey everyone, thank you for joining us here, at your community partner. We're here at Lehigh Valley Hospital, Schuylkill, as we try to inform you, give you updates of what's happening. A lot of great things always happening at Lehigh Valley Hospital here in Schuylkill, and as for that matter, for the network. Joining me now, no stranger to the show, is Terry Purcell. He is the president of the Northwest region, and he's president of the Schuylkill Lehigh Valley Hospital here in Schuylkill. So how are you, Terry?
Things are going great, Sam. How are you doing?
You've been busy?
A little bit busy. So we're very excited about our partnership with Thomas Jefferson University. Last week we signed a definitive agreement to merge. So that means there's basically no turning back now. So now it's in the hands of the federal and state government. And once we get their approval, we could begin operating as one organization.
So people have asked me, what is the benefit, for the merger with Thomas Jefferson Hospital?
So the benefits are numerous. So just to have access to Jefferson residents, physicians, fellows, hopefully at some point we could get them rotating up to Schuylkill County and Hazleton and Carbon Market. It's difficult recruiting in our community. What we've seen in our family residency, once physicians come to the community and get a taste of it, they fall in love with it and decide they want to be here. Jefferson has a health plan. The health plan is very important in the healthcare industry right now, and we'll be able to offer for Medicare and Medicaid patients a health plan that would include Lehigh Valley Hospital and the Thomas Jefferson University providers. We'll have access to over 700 new locations, so the access to care in the region will just be tremendous.
Wow.
We'll be one of the top 15 nonprofit healthcare institutions in the United States. And Purcell and Hazleton will be part of that, so it's just a great thing.
That's exciting.
And also we'll be able to get some discounts from purchasing, so we'll be able to negotiate better prices, and that will help us continue to be a financially stable organization.
Moving on with you have the Joseph McCloskey School of Nursing. A lot of things happening there, right? What's going on there?
A lot of great things. So as everyone knows, there's a huge shortage of nurses in the United States.
Yeah.
And our school is graduating 20 students on June 6th. Next year we have 53 second-year students that will be joining us. So we needed to expand our school. So we're adding a $6.5 million renovation to our medical mall behind our East Campus to expand the classroom. Next year, the first-year students, there'll be 60. So we're tripling the size of our graduates over the next few years. So everyone's excited about that. In addition, we're starting an evening and weekend program.
Yes.
That's a great thing. There's a lot of people that work and they still would like to go into the nursing profession. And it'll be a joint session where there'll be 9 students here and there'll be 9 students down in our Center Valley location. So they'll be getting some education virtually as well. So we're excited about that. That should start in August when the new class starts. And finally, we're working on an LPN to RN program.
Oh.
LPNs are great providers. A lot of them want to improve their skills, and we're going to make it easy for them to come to the Joseph McCloskey School of Nursing and get that degree. So we're doing a lot to improve the nursing workforce in Schuylkill County and the surrounding region.
How's the retention?
The students?
Yeah.
We do a very good job retaining them. Right now we're offering full scholarships. If someone wants to sign on now while they're a student, they just have to agree to work with us for 3 years, and they don't have to pay anything for their education, wow, which is incredible. So we expect to see better retention moving forward.
Now you have a new pediatric rehabilitation, correct?
Yes, so it used to be in the old South Jackson campus,
yeah,
and we have a beautiful rehab facility right near the campus. We spent a little over $1 million to renovate some space to move the Pediatric Rehabilitation Center. They're going to talk about that a little later in the show, yeah, but when you go over there, it's very impressive, and it's nice having the whole team together under one roof in one location.
The Orwigsburg location.
Yes, so we expanded our Orwigsburg location. It was closed for many years during COVID, and we recently reopened it. We recruited a new internal medicine physician, Dr. Amalikov, to join us. And he loves Schuylkill County, he loves being here. He says it's the best job he ever had. And we also expanded our OB practice. Right now they're at one location on Red Horse Lane, and we expanded them into this facility in Orwigsburg, and our goal is to take our providers out to the public, so the public doesn't have to drive and be inconvenienced, so we're trying to take them out there.
Wow.
We did the same thing in Hometown. That office was closed during COVID, and we have our OB docs going to Hometown as well. So we're expanding and growing, and we're seeing an increase in deliveries in Schuylkill County. So Pennsylvania as a whole is seeing a declining birth rate, and in Schuylkill County and in Hazleton area, we're both increasing the number of deliveries we do every year. So it's a good sign for our future.
You know, it's nothing like hearing from the people who work here. So we have some upcoming shows. We're talking about the new residents. You know, we'll be able to.
So right now, in the Walter and Irene Barron Family Medicine Residency Program, we have 8 residents. So we're in year 2 right now. Mm-hmm. We'll start year 3 in July. We have 4 new residents that are joining. That'll take us up to our maximum of 12. And so right now, 4 of the 8 residents have agreed to join Lehigh Valley.
Yes.
So that is so great. So hopefully in this next class, we were hoping to get 1 out of every class. So right now, we're far exceeding our expectations. So this is going to go a long way to building the physician supply in Schuylkill County and the surrounding counties. Right now, the average age of a physician in Schuylkill County is 63 years old. That's 10 years older than the national average. So it's important for us to be able to bring new physicians to the community to care for our residents.
Once they come on board and they see how great the hospital is, plus the area, I think that means a lot.
It goes a long way. And they're very involved in the community events. Mike Peckman has them all over the place. One physician started a walk with the doc at the Purcell High School.
Oh.
And they're very involved with our communities. We see them out at fairs. We see them out at different events. So they like being in touch with the residents, and they just love Schuylkill County.
So the hospital's always looking for doctors and nurses and aides, etc. When you look back, Terry, you know, doing the show a long time, and I've seen the progress, you know, in a number of years. It's just mind-blowing, you know.
It really is. We keep adding new services. We're always recruiting new physicians and nurses, and we're to a point now where we almost have enough nurses. So the whole United States is struggling with nurses, and at Schuylkill we're doing very good. We recruited a lot of experienced nurses, and our retention rate is the lowest it's ever been. So we're doing a lot to make sure that our colleagues realize how important they are to us.
The show today, I think, is an important show because we're talking about rehabilitation.
It's a very important show. First of all, my wife's a physical therapist, so rehabilitation is close to my heart. But our rehab team here is second to none. They do a great job in the community from an outpatient standpoint. We have some expertise here that a lot of hospitals don't have. And our inpatient unit, we get so many compliments because when someone needs inpatient rehab, they want to be close to home so their family could come and visit them, and that's all part of the recovery process. And our team up there just does an outstanding job, and when you hear some of the stories and some of the things they do for our patients, they're absolutely amazing.
What I really like about Lehigh Valley is the fact that whatever you say you do, you do. You know, like the show is your community partner. You are a community partner.
We really
It's
are.
not just the slogans. You know, I get frustrated when I see, you know, all these slogans, but there's no substance, okay? Exactly. But this hospital, the entire network is just substance, you know. And I'm hoping, and I'm sure it's going to happen when the merger happens, and there's all this opportunity, especially with the healthcare program. I think that's going to be interesting.
Exactly. Yeah. They have so many health education programs at Jefferson. Yeah. They graduate 900 nurses a year. That's a significant amount. Wow. X-ray program, all the rehab programs they have. Our employees will have access to the continuing education at Thomas Jefferson. So we're just very excited, and we can't wait for it to happen.
Yeah. Now, being the president of the Northwest region, how are the other hospitals doing?
The other hospitals are doing great. Up in Hazleton, we're considered to be very strong. We opened a cancer center not even a year ago. Sadly, our volumes are 2.5 times what we expected. Yeah. There was a report out in the newspaper a couple weeks ago, and just the cancer rates in Schuylkill County, and Hazleton, Luzerne County, and Carbon County are just astronomical. So It's made a lot of difference. We see people from Schuylkill County and Carbon County getting their care there, and a much needed,
Oh my gosh.
much needed service for the community.
Yeah, I said in one show, you had bad news and good news. The bad news is you hate to be told you got cancer, but the good news is you have the Lehigh Valley Hospital,
Exactly.
with the latest in cancer research and opportunities to help them,
And our Carbon campus continues to knock it out of the
Yes,
park.
yeah.
There were a couple of days we were completely full and we couldn't accept any
Yeah.
more patients. So within the last year we added more med-surg bed, we added an ICU, we added cardiac rehab, and it just continues to flourish. So all three hospitals are doing very well.
Well, as I say, Terrence, keep the good work up.
We will. I have a great team here.
Yes, you do. Your community partner, folks, brought to you by Lehigh Valley Hospital here in Schuylkill County. They say what they mean. We'll be back right after this. Well, welcome back to your community partner, my friends. It's brought to you by the Lehigh Valley Hospital Schuylkill. It's amazing the things that are happening at this hospital. Remember, 24/7, you can watch all of our programming, particularly all our health shows. And once again, I really appreciate when you come up and you tell us that you'll learn a lot from these shows. It's like bringing people into your living room, explaining what's happening. As you heard Terry talk about the merger with Jefferson Hospital, all the great things are happening, and we'd like to continue that. Now, rehabilitation, that's something I should really be getting involved in, rehabilitation. I'm joined here by Patricia, Patty Gregas, who is the manager here at the Lehigh Valley Rehabilitation. Now, you are outpatients, correct?
Correct.
All right. So now, Patty, tell me a little bit about yourself.
So I'm an occupational therapist by trade or by practice. So I graduated from College Misericordia and I'm a licensed therapist. I'm also certified in lymphedema management. And I've been with the organization 34 years. Started my career there and I'm still here. I started as a staff therapist and I'm now the manager of not only the Pottsville site but a site in Hamburg.
So tell me about, the different things about your rehabilitation when outpatients, when they need you.
So,
Is it a physician referred?
correct.
Okay.
So we're physician referred, so anyone can be referred for treatment. It can be an orthopedic, a neurological, a developmental condition. We treat from pediatric through geriatric, so across the lifespan. What happens is someone would be referred for treatment, we would schedule the appropriate therapy services, and then the patient is evaluated as far as what things we may assess and focus on in treatment to get them back towards independence.
Mm-hmm. Now, there are a lot of people that need rehabilitation, okay?
Correct.
And what services would you provide them? They have to go to the physician to get recommended to come to you. Is that correct?
Correct. It's physical, occupational, and speech therapy services.
Okay.
And then within that, we have service lines or programs that are designed to meet specific needs. For example, we can treat oncology patients, lymphedema management or pelvic health. We can treat pediatric, both developmental and then also pelvic health conditions. We can also treat post-operatively orthopedic or sports-related injuries. So it kind of goes across any type of injury or illness that somebody is impacting their function.
Mm-hmm. Now, obesity is a problem in the country today, okay? Do you address any of those
There
problems?
are some conditions related to obesity that we can assist with. One is just general ambulation, because typically when somebody is dealing with obesity, they may have more difficulty getting around. They may have issues as far as strength or balance, which physical therapy can assist with. They may also then develop conditions such as lymphedema, which
Yes.
deals with swelling, and that's something that we can also assist with.
Yeah. I've seen an increase in that in the recent years, okay? But there's a lot of times there's some people out there that have these problems and they just don't want to make the attempt, to do it. I think after you've seen them come in, you've seen the progress, and it's a world of a difference. Am I correct in saying that?
Correct. And we try to support and guide the patient when they're seen in therapy. So we're guiding them on what we feel can be of benefit at that time, but we're also teaching them for the long term, because you need to teach patients whether it's nutrition or exercises, posture, whatever it may be for the long term. So we do teach them as far as either the caretaker or the patient themselves, as far as home management as well.
Okay, so Patty, let's talk about the qualifications of the people you have working there, okay, and also the equipment you have, okay? So I'm always concerned, like, when you go to a doctor, what about this doctor? You try to learn as much as, or an LPN or a PA, whatever. Tell me about your staff and some of the state-of-the-art equipment you have.
So first of all, in regards to staff, all staff are licensed therapists, whether it be physical, occupation, or speech therapy. And then we have several therapists that have special certifications or special trainings. For example, in occupational therapy, we have a certified hand therapist, and then we have work-trained therapists that do functional capacity evals and assessments for employers to get patients or employees back to work. We also have vital stim trained therapists, which is in speech therapy, to help patients with swallowing or speaking difficulties. We also have sports trained therapists in our physical therapy, both from an orthopedic, and we have certified stroke specialists.
Okay, so if someone's out there knowing that they need rehabilitation, how do they go about coming to see you?
Well, what they need is a referral from the physician, and then it's very easy to contact our site itself. It's 570-621-9500, or the general LVHN line will also get them to the rehab center.
Yeah, you know when a person knows when they need rehabilitation. It's always, as like me, I'm the last person in the world. My wife's an LPN, I mean, she's an RN, and she's always on my back, you know, do this, do that, you know, exercise or whatever. And I think that's critical, you know. But you want to make sure you go to a facility that has trained people and have the equipment. So, well, keep up the good work. Okay.
All right. Thank
now, Erica.
Yes.
How are you, Erica?
Very good, thank you.
That's good. Are you behaving?
I try.
That's good. You are Stine in the inpatient. Okay?
Absolutely.
She's
yes.
outpatient.
Yes, that's
You're
correct.
inpatient. So tell me a little bit about yourself.
So I'm a registered nurse.
I love registered
Oh,
nurses.
yes, me too. Came to actually Schuylkill 32 years ago, worked as a staff nurse throughout the hospital, worked in care management, also worked as a registered nurse in our advanced wound center here at Schuylkill, and then went back to school. Lehigh Valley afforded me that opportunity, and so I went back to school for my bachelor's degree, and then took a position in 2017 as the director of the Stine Inpatient Rehab Unit.
So we're going to show a video, okay? What we'll be looking at?
So you're going to see the unit, you'll see a patient room, you will see the gym as well.
Okay. So we'll show that now.
Lehigh Valley Health Network is the region's most trusted rehabilitation partner. Stine Inpatient Rehabilitation Center at Lehigh Valley Hospital, Schuylkill, helps people reach their highest level of independence. So how do we do it? It starts with a beautiful state-of-the-art facility overlooking the city of Pottsville. Our gym is equipped with the latest technology to assist in your recovery. The Light Gate system allows you to participate in rehabilitation with a reduced risk for falling. Your therapist will adjust the amount of body weight you support during your exercises to customize rehabilitation to your specific needs. We even have a room set up to help you with real-world scenarios, like getting out of bed, getting in and out of the shower, even relearning how to use the kitchen or load a dishwasher, all so that when you've completed your stay, you have added confidence. When safety restrictions allow, patients can eat together, providing people with similar experiences the ability to connect and support one another. Rehabilitation patient rooms are a space for you to unwind while having the comfort of being in a hospital setting. That means if something unexpected happens, care is close by. Talk with your physician to see if inpatient rehabilitation services are right for you or your family member.
So Erica, let me ask you something. Why would someone need inpatient care?
So if someone is recovering from a serious injury, illness, or surgery, they would be better with some intensive rehab therapy to help them, assist them to get back to home quicker.
Okay, so now the question is, what makes Stine so special?
What makes Stine so special is we're the only inpatient rehab in all of Schuylkill County. We have performed above the national averages in our functional gain. So to take, for instance, the national average for functional gain of a patient is 35.7, where Stine has a functional gain of 43.8.
Okay, now let's talk about as I mentioned, Patty mentioned about her people that work in the outpatient. Tell me about the qualification of people that work in your inpatient unit.
Well, we have all registered nurses 24/7. We have physical therapists, occupational therapists, speech therapists. We have a social worker that's on the site and is dedicated just to the patients of the inpatient rehab. We have our physician who is Dr. Melantic Lynn. She's a physiatrist. She's our medical director. We have hospitalists throughout the hospital who come. Which is great about Stine is that we are located on the 7th floor of the hospital, so therefore we have access to all the specialties, and if a patient needs a consult, say to a pulmonologist or to a patient that needs a neurologist, that we have access to those individuals for the patient.
And once again, how do you get referred to go into?
Easy referral, so you do not have to be a patient in the Lehigh Valley Network. You can be a patient in another facility. You can just ask your case manager, your discharge planner to give a consult right to us.
That's important.
Yep.
Yes. That's great. So you have the opportunity, even though it's a different
Absolutely.
facility, can come to
Absolutely.
your facility, just referral, etc.
Absolutely.
I think that's fabulous.
Yes, it is. We've been serving the community for over 20 years, and we're very proud of our team.
Yeah. It's rewarding, isn't it?
Yeah, we have a great team. One of the things, a lot of patient feedback that I get, I round on our patients and make sure that we're meeting their expectations in relation to their care. And a lot of feedback I get from them is that the patients feel that our team treats them like their own family.
Yeah, referrals are so important. You know,
Yes.
like if someone comes in and they have this, I don't know if this is going to work, say, well, look, and you get permission from Sam, Sam came in, had the same talk
Yes.
to Sam. It's always like
The word of mouth, right?
That's so critical, But getting it there in the first place, So, well, I wish you both the best of luck. What a great organization.
Thank
And it's
you.
so nice
Thank
to see that you offer your services for other people who do not have those services. Okay, all right.
Well, thank you for the opportunity to be
It's
on
my
your show.
pleasure. Nice
Yes,
meeting
thank
you
you.
both.
Nice
Keep
meeting
the
you as
good
well.
work up, folks.
Thank you.
Your community partner, my friends, Lehigh Valley Health Network and the Schuylkill partnership here is just wonderful. There's so many great things happening. The phone number's on the screen. Go to their website. There's a lot of information that you could have, and take advantage of it. We have this great health care. Take advantage of it. We'll see you next time.